probably by the end of the week. If you don't know who I am, my name is Dr. David Boynton. I'm a chiropractor and I specialize in functional medicine. So this is our functional medicine approach to cardiovascular disease and cardiovascular health. What can you do about your blood vessels? What can you do about your cardiovascular system, and who's paying attention to it? So those are the things we're going to cover today. You have to understand some of the basics of the plumbing of your body. So what is the anatomy of the cardiovascular system? What are lifestyle things that are going to impact your cardiovascular system? Nitric oxide and endothelial cell health. This is what we're talking about for you. How to prevent cardiovascular disease and stroke. Is cholesterol really the bad guy? Some people think it is, some people think it's not. It's important that you understand the difference between upstream medication and downstream medication. What can I do about my hypertension? It's high blood pressure. What labs should be ran? And then how can you treat it with nutraceuticals and lifestyle medicine? So those are all the things we're going to cover. So vascular disease is the #1 killer in the world. More than cancer, more than anything else, and stroke. Myocardial infarction is due to 15% of them are due to strokes. So it's a big deal. We don't talk much about it when you're in your 20s, 30s, 40s. Maybe in your 50s, doctors start paying more attention to it. It doesn't become a real problem until your 70s if you don't really do anything about it. The average age of an adult male to have a heart attack is 72. So it takes 72 years to clog up your arteries before you have a heart attack, before there's a significant ischemic attack. Women, it is 76. So it does take a long time for it to accumulate, but the goal is to have it not accumulate. And what is also important, your cardiovascular system is extremely important for your brain health. We don't think about our brain health in our 20s, 30s, 40s. We think about our brain health and our cardiovascular health as we age. And those things are both important, and it's hard to fix them when they're gone. So let's try to stay ahead of all these things. So this is your cardiovascular system. So the veins are going to be kind of blue because they carry deoxygenated blood away from the heart, and the arteries are going to appear red. That's kind of how most charts have them set up. Your blood's red, whether there's oxygen in it or not. It just appears that way as your skin is translucent. It appears that way because there is a little bit less oxygen in arteries, in veins than there are in arteries. So the capillaries that's what helps to connect the veins and arteries together. It all has over 10,000 miles of veins, arteries, or 100,000 miles of veins, arteries. That's incredible. Like in this body, there's that much stuff. Kids have 60,000 miles. And it takes about 20 to 15 seconds for blood to leave your heart and circulate back to your heart. And that's incredible too. So it can go through 10,000 or 100,000 miles of tubes in 15 seconds. That is a lot of pressure. So all that pressure is what drives hypertension. So there's all kinds of bends and twists and turns, and right at those corners, that's where that blood pressure is pummeling our veins and arteries, and that's where we have vascular disease, which then impacts your endothelial cells, which then impacts your nitric oxide synthase, all goes inside your endothelial cells, which drives vascular disease. So your pulmonary system, so this is how your heart, you actually get oxygen into your blood. So you obviously breathe in air, and air in Cincinnati is dirty today, like it normally is in the summertime. That oxygen then goes through the alveoli, which is going to be right here on the very outer perimeter of your lung, and all of your lungs are lined with thousands of miles of capillaries, which then dump those the oxygenated blood into your system. So that binds to your hemoglobin and red blood cells, and that travels, and your heart distributes that to your body. So what are some lifestyle risk factors associated with cardiovascular disease? Eating an inflammatory diet, a SAD diet, which is a standard American diet, full of processed foods, trans fats, inflammatory grains, and dairy. Those are all bad things for you. But people don't think about eating that on a regular basis because what's what everybody else eats? Well, everybody else in our country is sick too. We're one of the sickest countries in the world, so you should probably do something opposite that everybody else does if you want to be healthy. You should be in the minority, not the majority when it comes to what you eat. If you don't sleep well, that greatly impacts your cardiovascular system, especially if you snore or have sleep apnea. So when you snore, you pause your inhalation for just a split second. So if you snore or have sleep apnea, you're hypoxic, which means you don't have oxygen going to your blood vessels, your heart, or your brain, and over time, that really impacts your vascular epithelium. Being lonely, isolated. People had more cardiovascular disease episodes during COVID than in recorded human history because people were alone. I think it's because people were so stressed out for the blood flow as it goes back behind your knee. If you have a repetitive job or you have trauma to your body, that can cause some lack of exercise. So lack of exercise is bad and too much exercise is bad. You need the right amount of exercise, and I'll talk about that later. Chemical exposure. We can't avoid chemicals. I guess we can, but inherently living in this country, you're not going to avoid chemicals. You just can't. There are some that you can avoid, like not being around someone who's smoking. Don't spray chemicals on your lawn. Use natural fabric softeners and detergents. So things like that you can control. But a large majority of people cannot control chemicals, especially when you live downtown. The exhaust is just in between the buildings. It just kind of sits there. That's something you guys need to consider too, is walking when there's less traffic out, not walking during the high traffic times of the day. Oxidative stress from critical damage, we'll talk more about that later. Poor stress management, obesity, insulin resistance, and diabetes. So when you have elevated blood sugar because of diabetes, I like to describe blood sugar as little pieces of quote unquote sugar or glass that are sharp, that are going through your blood vessels and arteries and veins. So those things cause damage to the insides of your tubes. When you have damage to the insides of the tubes, that causes inflammation. Inflammation in a tube narrows the tube. Now you have to have a higher velocity of blood to push through a narrower tube. Now you have high blood pressure. So one of the primary causes of high blood pressure is high blood sugar. And one of the causes of high cholesterol is high blood sugar. So we call that metabolic syndrome. Those all three go together. So even being around, if your parents smoked when you were young and you're an adult now and you never smoked, that does increase your risk of having cardiovascular disease and stroke. Your microbiome, your GI tract, and the bacteria in your mouth have a lot to do with your cardiovascular system and your brain health. We'll talk more about that later too. I think that's pretty interesting. Microtraumas, again, we talked about that a little bit, and then nutritional deficiencies. Those are all things that can impact your cardiovascular system and your brain from a lifestyle standpoint. You've heard and seen nitric oxide in endothelial cells a couple times. So nitric oxide protects your vascular epithelium. The vascular epithelium, that's the inside of your tube. So some of you are my patients in this room. We may have had you put a little strip in your mouth and see if it changes colors. If we haven't done that, remind me to do that at our next appointment, and we'll see if we can identify if you have adequate levels of nitric oxide in your body based on these little strips. And if you don't, that means you can have damage to the insides of those tubes, which causes that calcium to lay down inside your blood vessels. So when your nitric oxide is low, literally it causes platelet aggregation. So that's what happens. You can see normal at the top, that's a little bit, maybe that's 20, that's 50, and that's 70. So to prevent that from happening, you need to have adequate levels of nitric oxide to prevent all that from happening, because the inside of the tube needs to stay healthy. Nitric oxide and something called the glycocalyx. I can't spell, it's kind of fun to say. But that's really important as well, and there are key nutrients that are important to keeping those things healthy, because the healthier your cardiovascular system is, as you age, the healthier your brain's going to be as well as you age. So these are really important things to consider. So this is kind of what we see, talking about vascular injury. So those are all the things that cause, probably not all the things, those are all the important things that cause vascular injury. So prostaglandins are inflammatory hormones. Adipokines is inflammation from your fat cells. Inflammatory cytokines come from everywhere. I'm not going to go through the list. Elevated insulin, so this is high blood sugar, high blood pressure, oxidative stress, medications, microbiome, that's your gut, lacking antioxidants, toxins, air pollution, cigarette smoking. So lots and lots of things cause that narrowing of the tube. So this is your epithelial lining right there. So that inside of the tube is super important. That needs to be smooth so that all the blood flows very freely and easily to all the parts of your body to help your body recover and heal and prevent diseases from happening. One thing that I always ask my patients is if they have nail fungus. And if they say yes, I'm like, have you ever been successfully able to treat it? Sometimes yes, sometimes no. Sometimes I've had it for 20 years, nothing ever works, not even topical stuff or medication. I'm like, it's because you have lack of blood flow to your toes, the nail beds of your toes, so you can't get your immune system, T and B cells, to your nail beds. It's never going to get better because you can't get your immune system there to heal it. So that just talks about how important the cardiovascular system is to really all the parts of your body. So this is something called arteriosclerosis. You all have probably heard this before. So it's when your body lays down plaque, and it can be hard plaques or soft plaques inside your blood vessels, inside the actual epithelial cells. So this is normal. So wide open lumen, we call that the lumen, that's the hole. So you start to have some endothelial cell dysfunction. So that's how inflammation starts, and you get particles that lay down and stay right there. These are commonly at the bends and the corners throughout your entire body. As you age, you start to get what we call fatty streak formation. So that's actually fat cells that get stuck. My pointer doesn't work on the TV, I don't think, yeah. So the fat cells get stuck inside those blood vessels, and over time, it becomes a fibrous plaque, which is what we see in number 4. So you can see half the lumen is occluded, and then as you get older and you're more inflamed, you have those unstable plaques. That's what breaks off and causes strokes oftentimes. So this is kind of how it all starts. So maybe this is, and this is not true, but this is your 20s, 30s, 40s, 50s, 60s. It's a gradual progression. But there's a lot of things that you can do about it, stop the damage from happening, and even reverse it. We'll talk about that at the very end. So this is what it actually looks like inside your body. I thought that was kind of cool. For me anyway. I don't know if you guys are grossed out by it, but that's what it looks like. You can see that's some progression. So that is, even this is occlusion. These are the fatty streaks. This right here and this right here. That's your endothelial lining right there. So even that is a narrowing of the tube. This is you have a heart attack and stroke. And that's what it looks like. That's right where the Y is. Call that the crotch of the vein. You can see how all that junk is just built up right there. So you have 100,000 miles of these things in your body, and you have accumulation in half of those. That's a lot, and that's over time. If you bang your elbow gets inflamed. If the tube gets inflamed, the tube gets smaller. We got to keep our tubes large by making sure we don't have vascular damage by all those lifestyle factors and maximizing our nitric oxide and from a supplement standpoint and from our diets. So how do we prevent it? Don't smoke. Duh. Don't be around people that smoke. Duh. But it has to be said. Interestingly enough, loneliness has a larger impact on your cardiovascular system than smoking. I thought that was very interesting when I came across that when I looked at research. Limit alcohol consumption. So people ask me, how much alcohol is the right amount of alcohol? I don't know. The answer is less than you're drinking, because only people that drink a lot of alcohol ask that question. So the answer is less alcohol. There have been a few studies that have shown very small amounts of for drinking alcohol, but there's really no health benefit to drinking alcohol. Controlling your blood sugar is very important, because again, that blood sugar are like tiny little pieces of glass or sharp sugar molecules going through all those tubes of your body that is causing damage to the inside of the tubes. And it's over a long period of time, not over 5 years, but over 40 years. So that's something that's very important to control. Consuming as much of an anti-inflammatory diet as you can. An anti-inflammatory diet sounds like a paleo diet. Most of you have probably heard about that. So paleo diet is eating like a Paleolithic man. So it's fruits, vegetables, and meats. It's limiting or no processed foods. It might be a little bit of a hassle, but having a disease process is a bigger hassle than maybe being inconvenienced by your food and your food choices and where you go over the course of your lifetime. Exercise is very important. So think about your blood vessels as a river. The longer water runs through the river, it starts to erode away the riverbed, right? So when you exercise, as the blood goes through the blood vessels, it can actually start to dissolve and wear away some of those calcium and the soft plaquing inside your blood vessels. So exercise is very important. Now, too much exercise is bad, and not enough exercise is bad. So at minimum, you want to exercise 20 to 40 minutes 3 to 5 times a week. Now, can you do more than that? Yes. Can you do less than that? Yes. But that's kind of what research shows is the best duration of exercise. Now, what kind of exercise can you do? The best exercise is the exercise that you'll do on a consistent basis. I don't care what it is. You just have to move. Movement is crucial for your cardiovascular health and your brain health as you get older. The studies that are published on PubMed, they talk about brisk walking as the exercise. That's something that most people can do is a brisk walk. So a brisk walk is considered something you can have. It's difficult to have a conversation with somebody that you're walking next to. A stroll you can very easily have a conversation with the person next to you. That's not considered brisk. Running is when you're out of breath and you can't have a conversation. So you should be able to ask simple questions and simple responses. That's considered a brisk walk. A little bit out of breath, maybe a little bit of sweating. If you can't do that, get in the pool. And you can walk in the pool. You can do exercises in the pool if your joints aren't safe enough to do that. Even an upper body ergometer, it's like a bike for your arms, you can do that too. Or you can ride a stationary bike, but exercise is really important for your brain health and for your cardiovascular self. Optimize the microbiome diversity. So the microbiome is your GI tract. The microbiome is the bacteria that live in your GI tract. So eating the same foods every single day, day in, day out, or longer time, reduces the diversity of healthy bacteria in the GI tract. So you want to eat a large variety of foods, and ideally it's fruits and vegetables. The larger variety of foods you have, your body makes more something called butyric acid, which helps not only the lining of the GI tract, but the endothelial lining, the lining of the actual tubes of your cardiovascular system. And it reduces something called TMAO, trimethyl oxide. We'll talk about that in a few slides. That reduces that because that has a direct impact on your cardiovascular system. Identify repetitive movements causing microtraumas. So again, if you sit as a career, that's a problem. On a keyboard, that's a problem too. So you can have microvascular damage here, you can have microvascular damage here on your legs. Working construction, being on your feet on concrete for 30 or 40 years, you're gonna have microvascular trauma to your feet and to your legs. Just like some women when they're pregnant or obese guys have varicose veins in their legs because of that additional weight they had to carry. Those are all physical traumas to your vascular system. It's important that you socialize with others. And if you can't get a pet, what kind of pet should you get? The one that you won't kill. It doesn't matter. But sometimes you just need to unload your stress to somebody. Typically a dog seems to work best because they're more social animals, and even if you live in a city or environment, you kind of have to take them out. So it kind of forces you to exercise if you have a dog. Cats, they don't really care if you're there or not. They just want to be fed and their litter box changed. Reducing your chemical exposure. As much as you can, consume organic fruits and vegetables. Limit the amount of cosmetics you put on your skin or on your face or in your hair if they are. Try to make them more organic as possible because those are things you can control. You can't control the exhaust outside. You can't control the pollution, the outgassing that's coming off of the floor. Sorry, I'm killing you all slowly because you're in this building. Because you're in your house, the formaldehyde coming out of your fire retardant clothes, and your fire retardant mattresses in bed, you can't control those things. But there are things that you can control. So that's important as well because that creates inflammation in the body. And the cardiovascular system and your brain are very sensitive to inflammation. Maintaining your weight is important. the more obese you are, the excess body fat you have, that creates inflammation that is stressful on the cardiovascular system. You have to know what your numbers are, and we'll talk about those here in the next few slides. Sleeping soundly is also very important. Having uninterrupted sleep. Some people say, I sleep 8 hours a night. I'm like, well, how many times do you get up? Do you snore? Do you actually have restful sleep? And not only restful sleep, but are you sleeping at the right time of the day and night, or right time of the night? The most restorative sleep is between 10 a.m. and 2 a.m. or 10 p.m. and 2 a.m. That's when your body is going to get the most restorative, restful sleep. So if you're a night owl and you don't get to sleep, you don't get to bed till 12, 1 o'clock in the morning, you're really missing a lot of that healing that healing opportunity that your body can do. Now, it does not mean that your body will not heal, but that's the sweet spot for sleeping and healing is between those hours at the night. And managing your stress properly is important as well. So managing your stress could potentially be number one, because when people are stressed out, they eat their emotions. And when you're stressed out, you typically don't say, man, I'm so stressed out, I need some carrots. That'll just make me feel better. Or some broccoli, that's gonna be great. You want ice cream and unhealthy food that creates inflammation. Or you want to drink alcohol, which creates inflammation. Or you want to do drugs, which creates inflammation. Or you want to smoke cigarettes, which creates inflammation. You don't want to exercise, which creates inflammation. So making sure that you can manage your stress in a positive way is very, very important. And we all have bad habits of how, most adults anyways, have bad habits of how we manage our stress. So understanding that you do have a bad habit, and when I want to go and do this thing I know is harmful, you have to train yourself, okay, my trigger is this, I want to go do this, but I have to go to this positive thing instead, until this positive thing is now your healthy habit instead of turning to a bad habit. Cholesterol, good guy or bad guy? Depends who you talk to. So I don't talk to people, I read what the research says. So this is what the research says. It is your friend because it's important for your brain health. Your brain will not work right and will become inflamed if your cholesterol is too low for too long. I know it's funny to say low cholesterol is a problem, but too low cholesterol is a problem, just like too high cholesterol is a problem, just in a different way. It's important to make sex hormones, especially testosterone. We as men need lots of it, women need a little bit, but testosterone is important for your brain health and for lots of things in your body. It's important to lubricate your skin. So people that have chronically dry skin and they're on a statin medication, the reason why their skin is dry is because of the statin drug. It's important to make cortisol. Cortisol is important. Too high cortisol is bad, too low cortisol is bad. So cortisol is a stress hormone produced by the adrenal glands. When you're under stress in fight or flight, your body produces cortisol to help you get away from the dinosaur. So when to skip the dinosaur, you should go back into a sympathetic, or you should go back into a parasympathetic resting state. But when you don't and you have too much cortisol production, that's inflammatory to your body. So what happens is your body takes cholesterol and makes cortisol. Well, if you don't have the cholesterol, there's a raw ingredient, you can't make your sex hormones. So it's important to be not stressed. It helps to make bile. Bile is important for breaking down fat and protein in the GI tract. And it's also important to help lubricate the GI tract. So some people that are on statin medications have constipation, they have poor absorption of nutrients, they have dry skin, they have leg pain, they don't want to have sex, and their brain sucks. I want that drug. Give me extra. I want to feel like crap every day to have normal cholesterol. I don't think so. But is it bad? Yes, it can be bad. So we can't ignore everything. There's evidence that shows that too high cholesterol does increase your risk of cardiovascular disease. It does increase your risk of stroke. It is a contributing factor to arteriosclerosis. It can increase your blood pressure, and it can cause peripheral artery disease. So we can't just ignore cholesterol. But cholesterol shouldn't be something that you're scared of. I have so many patients that their doctor wants to put them on cholesterol medication when their cholesterol is normal. I'm like, why would I want to do that? Or we're on diabetic medication, put you on metformin and your blood sugar is normal. Why would you want to do that? Because of the risks? I'm like, you actually have a greater risk of developing other diseases because you're on medications that you don't need. So there's all kinds of natural things that you can do to reduce your risk of having high cholesterol and high blood sugar. So 50% of the people who have heart attacks have normal cholesterol. We've all heard, keep your cholesterol down because it reduces the risk of heart attack, right? And in some cases it does. If it's 500, you should probably go on a cholesterol medication because you need to get that guy down now. Maybe even 2. Who cares about side effects? But to say you're gonna have to take it for the rest of your life, no way, Jose. That was just silly. So the evidence isn't even there. They're making their decisions on antiquated evidence that was from the 1970s. There was one research study that showed a casual relationship with cholesterol medication and heart disease. So therefore, everybody needs it. And now it's $1 billion industry. Look what we see here. Cholesterol medication, other medications that are for your cardiovascular system. So many of you may have heard of these, many of you may be on these. So 85% of the world's deaths are from cardiovascular disease. The top 2, 5th, 6th, 8th, and 9th are all designed to prevent that from happening, and yet 85% of people die from that? If these really worked, why would 80% of the deaths in the world be caused by cardiovascular disease if that's the amount of medication that people are using? And this is just in the United States, this isn't the world. $363 billion. And we're one of the sickest countries in the world. That doesn't make sense. And yet doctors do it every day. And that's not their fault, that's how they're trained. We cannot hold that against them. And there is a time and place for medication. But it's when you cannot control it with your lifestyle and your diet and your nutrition and your relaxation techniques and things like that. That's when you put people on medication. When they can't do it on their own. That's not the first thing you do, that's the last thing you do. Just like surgery is the last thing you do, not the first thing you do, unless it's an emergency. So that alone should show that there's a problem with the model that we're working with right now. So in chronic cardiovascular disease such as hypertension, ischemic heart attacks, heart failure, and progressive use of multiple drugs is common and is recommended by international guidelines. However, the chronic use of 5 or more medications, which is called polypharmacy, has been shown to neither always be efficacious nor safe. Polypharmacy is associated with increased risk of mortality and death. The more drugs you are, you're going to die sooner than being off of drugs, and it's going to cost you and your insurance company a lot of money. They don't work. Drugs don't treat chronic conditions. Your lifestyle treats chronic conditions. Your lifestyle caused you to have a chronic condition. So you have to fix your lifestyle by doing all of the things we talked about earlier. And this is completely controllable, and you can do this, and you do this, and you raise your kids to do this, and that's just their normal. And they're just healthy because they do what normal people do, which is who you are, the educated people that are here and watching us online. So it's very important because you have to be the one to take care of your cardiovascular system as opposed to hoping a medication is going to work when you go on in your 50s, which is what the most common thing is. We talked about the upstream approach and the downstream approach. So this is when you can't fix it up here with your diet, lifestyle, nutrition, everything we talk about, then you need these things. And sometimes you need drugs. I'm not going to say all drugs are bad because they're not. There is a time and place for medication. But in my world, as a chiropractor, a functional medicine doctor who can't prescribe drugs, I live in the upstream medication world. Now, sometimes we can't fix people with upstream medication, but oftentimes we can. And that's with educating them and recommending nutraceuticals that have been shown in research to be very effective for helping these things. So a sedentary lifestyle causes endothelial cell dysfunction. That's the inside of your tube that gets inflamed, that gets smaller, that causes you to have heart disease and impacts your brain health tremendously. Oxidative stress. What is oxidative stress? Free radical damage causes oxidative stress. What are free radicals? Free radicals are damaged cells that try to steal electrons from other healthy cells and cause them to become damaged. So what is the remedy for that? How do you put out the fire of free radical damage? You use antioxidants. Antioxidants are found in nature and found as nutritional supplements and even synthetic ones that actually are electron donors. And what they do is they give their electrons to the free radicals to help to heal them and or stop them from stealing other cells' electrons. That's what happens at the cellular level. So what are antioxidants, or what are they in? Leafy green vegetables, berries. So the healthy stuff, the brighter the color, typically the more antioxidants they have. So, and you want to have a large diversity of those leafy green vegetables, all the colors of the rainbow, because that's going to help your microbiome to reduce your TMAO levels, which we haven't got to yet. So that's very important. Having high, so dysglycemia, having high blood pressure, or having high blood sugar, causes endothelial dysfunction, hormone imbalance, microbiome dysfunction, that's the gut bacteria. Pollution and chemicals causes nitric oxide dysfunction as well. Nutrition, nutritional deficiencies, and caloric excess, so eating too much. So if you have a problem with your weight, how many calories roughly do you burn a day, and how many calories do you eat a day? But more importantly, what is the nutritional density of the food that you eat is way more important than your calories. 2,000 calories is kind of what, for most men, is recommended, about 2,000 calories a day in a sedentary lifestyle. You can have 2 Big Mac meals from McDonald's, that's 2,000 calories. You can have 20 pounds of fruits and vegetables, that's about 2,000 calories. One has nutritional density, it saves your life, this one kills you. Same calories. So calories aren't always the biggest thing, it's your nutrition, your nutrient density, which is the most important things. So when this fails, and you have significant arteriosclerosis and hypertension, then you might need some of these medications. You might need statin drugs. You might need fibrates. You might need bile acid sequestrants. You might need a diuretic. You might need some beta blockers. So we don't talk too much about these things because I can't do them, but when it's broken, this is what happens to you. So the goal is to prevent these things from happening, so you don't need drugs, which are going to kill you anyways, because you're typically not on 1, you're typically on 5 or 6, and then this is what happens to you. So preventable, controllable, the earlier you start, the better. So hypertension, what can you do about your hypertension? So the primary cause of hypertension is vascular injury. The inside of the tube is damaged. The endothelial cells inside the tube and the glycocalyx is damaged. Why? Because you have low nitric oxide levels. Because you have elevated TMAO. TMAO, I mentioned it before, trimethyl N oxide, is from the digestion of meat. So what happens is when you don't have a large diversity of microbiome from all the diverse vegetables and fruits that you should be eating, and even the gut bacteria in your mouth, the byproduct of that is oxidative stress, or the exhaust. So that greatly impacts your cardiovascular system, and it's extremely inflammatory. So it's like pouring gas inside your blood vessels, and significantly increases the rate of vascular injury. And we don't use oregano oil to kill it like you would a normal bacteria. We actually use antioxidants to heal the free radical damage caused by the inflammation. That's how we get rid of TMAO. Arterial.
Is that meat, when you say meat, is that red meat or just?
Mainly red meat.
Okay.
Yeah, but red meat's not bad for you. Too much red meat when your microbiome doesn't work right is bad for you. Another thing that's bad for you that increases your TMAO levels is mouthwash and fluoride in your toothpaste, because it kills the good bacteria in your mouth. Now, fluoride is good for your teeth, but it's bad for your body. A mouth rinse is good for your mouth, but all the alcohol in there kills the beneficial bacteria. So studies have shown that people that use fluoride in their toothpaste and mouthwash every single day have elevated TMAO levels, and they have elevated cardiovascular disease. So I use mouth rinse and fluoride-free toothpaste. Arteriosclerosis, a narrowing of the tube. If the tube is narrow, it has a higher velocity of blood, simple plumbing. High sodium diet creates inflammation and narrows the tube as well. If you pour salt on something, it shrinks it down. So too much salt in your diet constricts your blood vessels, which makes your blood pressure increase. Low potassium, magnesium, being obese, having high blood sugar, and chronic stress. So how do you prevent those things from happening? If you have high blood pressure, there's been a diet that's developed, it's called the DASH diet. So it's the dietary approach to stop hypertension. Have you guys heard of that before? Yeah, so if you have, it's a diet high in potassium and magnesium. So what is it? It's a lot of fruits and vegetables. We should eat lots of fruits and vegetables because, again, that increases the diversity of the GI tract. It's anti-inflammatory. It promotes nitric oxide synthesis, the creation of nitric oxide, which heals the endothelial cells inside the tubes. So hopefully I repeated myself many times about some of these very similar things. Maintaining a healthy weight is important. Obviously, don't smoke. Eat a diverse, colorful diet. Proper stress management, maintaining healthy blood sugar, and making sure you try to maintain normal cholesterol levels as much as you can. So one important thing to know about is kind of, what am I looking for? How do I know if I have risk factors of cardiovascular disease, and at what age might I identify that? So one common thing that not all people understand that's a risk for cardiovascular disease is male pattern baldness. When you don't have adequate blood flow to your scalp, your hair falls out. If you don't have hair on your legs as a man, is it because your muscles are really tight, or is it because you don't have enough circulation to the hair follicles in your skin so that your hair on your legs falls out easily? So those are some things that you guys can check out. So we've kind of made a scale of 0 to 10 of kind of what's normal and what's not normal. So most people don't present with any of these symptoms. But when we start to get in right about here, now this could be really at any age. So these are some symptoms associated with low nitric oxide. Your muscle stamina decreases. Man, I can't do what I used to be able to do in the gym. Is that because I'm getting older? Or is it because I have lack of nitric oxide? I can't focus or pay attention for as long as I used to. Is that because I'm getting older? Or is it because I don't have enough nitric oxide? Sexual stamina. That one I think is pretty self-explanatory. Erectile dysfunction in men. If women cannot have an orgasm, that can be a sign of having poor blood flow to your clitoris. So that's the opposite of the male sex organ. Is obviously the penis. The clitoris is for females. So if you can't have an orgasm, it might be because you don't have enough blood flow going there. Nitric oxide problem. Poor circulation to your hands and feet. Cold hands and cold feet all the time, even when you shouldn't have cold hands and cold feet. Inability to adapt to altitude and delayed in tissue recovery. These are all signs. I'm just getting older, so these are normal things. Are they normal, or are they signs of having low nitric oxide? Now, some of these things are signs of aging, and they are not because of low nitric oxide. But oftentimes, nitric oxide is the root cause of a lot of these vascular problems. So then we start to get some hypertension. So this is your risk of having really bad things happening to you. You start to get a little bit hypertensive, kind of stage 1, hypertension stage 2. Then you start having some chronic venous insufficiency. Then we're talking about you're moving into peripheral artery disease. You're moving into even more significant hypertension, vascular dementia. So, but your cardiovascular system is very important for your brain health, as you all know. If you don't have adequate blood flow to a part of your body, that part of your body doesn't do well and it cannot recover because it's not being brought proper nutrition. Think of your brain as like an extremity. It's one of the furthest things away from your heart because everything goes from your heart down the right side of your body, down the left side of your body, and back up. So when you get up quickly, and you get lightheaded, it could be because you have lack of blood supply to your head just for a second or two, and then you're fine. That's not normal to not have blood flow. So the more often that happens, that's a micro assault to your brain. The more that happens, that creates inflammation to your brain. The more that happens, you have increased risk of having dementia or vascular dementia. Episodes of angina, it's heart pain. And then you have obviously heart attack, stroke. So those are all some things that you guys can think about. Do I have that? Can I exercise as long as I could? Can I read a book for as long as I can? Do I get tired and want to pass out after reading one page? It could be because you're not getting adequate blood flow to your brain. Do I have no hair on my legs? Now, some ethnicities don't have body hair. That's a completely different story. But if you should and you don't, that might be a problem. What lab tests should my doctor run? Maybe they run them, maybe they don't run them. I don't know. But this is kind of what we run when we're looking at a comprehensive approach to looking at your cardiovascular system. So your lipid panel, which is your cholesterol, triglycerides, LDL, things like that. These are things that your doctor typically runs on every single patient, probably every single time as an adult. But within that, you can actually look at the particle sizes. So the particle sizes are called lipoproteins. And what happens is in the bends of the tubes, as they get inflamed, you get little tiny cracks in there. And the small LDL particles get through there and create more inflammation, which causes the cracks to become larger. The body lays down more cholesterol as a response to that. So it's kind of putting plaster over the cracks. And over time, that builds up, and those either break off or they create high blood pressure, which then they have more velocity, which increases the risk of them breaking up. So we can actually measure how many small, dense particles you have. So think about a tennis court. If I hit a tennis ball against the tennis net, it stops. Those are your large, dense foam cells. But if I hit a golf ball through a tennis net, it goes through. The golf ball is those small, dense particles, and that's what we don't want to have. And we can measure those through blood work. And there are supplements that actually diagnose to help fix that. TMA, we talked about that already. That's the bacteria from the gut and from the mouth that create inflammation in the blood vessels because of lack of diversity of the microbiome, the gut bacteria, and not enough antioxidants in your body. So your antioxidant reserves have been exhausted. CRP, C-reactive protein, and you can actually do high sensitive C-reactive protein. It's inflammation of your cardiovascular system. So most doctors run that too. We want that to be less than 1. Most labs say less than 3, but we want to see it as low as possible because that's just a precursor to having potential for cardiovascular disease and problems with your brain and pain in your entire body. Homocysteine. Homocysteine is blood vessel inflammation itself. So there's a process in the body called methylation. Methylation does over 500 different things in the body. And one of those things in the body that it does is it converts methionine into homocysteine. So if you have an MTHFR gene mutation, which most people on the earth do, your body can't do that well. So you have elevated homocysteine levels. Very few medical doctors run this test, unfortunately, because the solution is very simple. Take methylfolate and methyl B12. It's a very inexpensive fix, and a lot of these people that have heart attacks in their 50s and 60s, they look so healthy. I don't know how they died. They had high homocysteine levels, high CRP levels. Some of them went to the doctor, and some of us men aren't smart, don't have a doctor. So these numbers were never measured on them. But if these numbers are measured, they may have been caught, because you can have normal cholesterol and everything else be off. Doctor's like, my cholesterol's normal, we don't run any more tests. And that's unfortunate. At least run them once a year just to make sure they're fine. Fibrinogen, this is actually fibrous tissue inside your blood vessels themselves. So these don't become hard calcifications, these are actually soft tissue plaques that develop, that can break off and go to the brain and cause a stroke. So fibrinogen levels can be measured. Fibrinogen is also considered an acute phase reactant. It's very inflammatory to the endothelial cells in the blood vessels themselves. Ferritin talks about stored iron that actually takes place in the liver and requires vitamin C. But when ferritin gets really high, it's also considered an acute phase reactant, which is very inflammatory to your body, it's caused by elevated oxidative stress. What causes oxidative stress? Everything. Physical, mental, emotional, chemical stress, over exercise causes that, poor ability to manage stress causes that. So lots of things cause that. So what we do is we take lots of antioxidants and bolster our antioxidant storage so these levels go down. Glucose is pretty much measured by every single doctor, probably almost every single day, every single time they run that. So we want to make sure that's low. LabCorp says it should be less than 95. I think it should be less than 100, honestly. Hemoglobin A1C, if you're diabetic, you have a very intimate knowledge of that number. That needs to be as low as possible. In functional medicine world, we should be less than 5.5. LabCorp says pre-diabetes is 5.8, I believe, or 5.9, so we want to see that less than that. So that's glycolated hemoglobin. That is oxidized hemoglobin is how that's measured. So if you have normal insulin and normal glucose and elevated A1C, that does not mean you're diabetic or pre-diabetic. That means you have a significant amount of oxidative stress and you're lacking antioxidants. That doesn't mean you're going metformin. That means you increase your antioxidants a lot to get that acute phase reactive marker down. Pathogen antibodies, so harmful bacteria in the GI tract can increase your risk of cardiovascular disease. So doctors should run that too. Heavy metals, we don't do that very often. That's not a common test to do, but it's worth mentioning because heavy metal toxicity in your body is a significant strain and causes a significant amount of oxidative stress in your body. Oxidized LDL in your lipid panel, LDL is always something that's ran. That's oxidized cholesterol. But this is a specific marker. It's even more specific to oxidized cholesterol. The higher that is, that's probably one of the worst markers to have high. That and MMP9, metalloprotease. Those are the two probably worst markers to have when we're talking about a cardiovascular score. Essential fatty acids, omega-3 fish oil. We don't eat enough fish as a culture in the United States. It's just most of us are far away from the coast, so it's hard to get good fish. So most people eat a high omega-6 processed foods in their diet, which impacts your body's ability to use properly the omega-3s. So you can run the test to see where's my omega-3 score at. MMP9 is a blood test as well. That looks at it's a particle in your blood that creates inflammation in your bloodstream. ApoE polymorphism. There are 4 different kinds. There's E1, E2, E3, and E4. E4 is the worst. E4 is the rarest. E4 is 1% of the world's population, and I have it. Yay! And so does my family, which is why almost everyone has a stroke or cardiovascular disease on both sides of my family. So I'm not scared. I've been proactive since I learned about this when I was about 25. So I've been taking lots of antioxidants, taking lots of supplements to make sure that I don't have a risk of cardiovascular disease, stroke, or Alzheimer's, because that's what people have E4. And that's a blood test you measure. You do it once, that's what you're going to be forever, and then we can kind of come up with a game plan or a lifestyle, diet, nutrition plan of kind of what your diet should look like forever. And these people their cholesterol is not necessarily always high, but their LDLs and their triglycerides are very high. So if your LDLs aren't really high and your triglycerides aren't really high, probably not super important to run this test. If you have that and it's a family history, then it's probably important that we look at ApoE mutation. Fasting insulin, vitamin D3, and coronary artery calcium score. So that's a pretty cool CT scan. It's radiation, it's bad, but sometimes knowing what your number is for this is more important than the negative impact of radiation on your body. Normal is 0. 0 is the goal. Anything above 0 is bad, and the higher number is bad. This shows all the hard calcification plaques from about your groin to your shoulders. So right in here where all the important blood vessels and all the important stuff is. It's going to give you a load or a score. What's cool is that ProScan here in Cincinnati, you can actually just walk in, you can actually call, schedule an appointment, and go get the test done. You don't even need a doctor to order it for you. And the test only costs $110, so it's not expensive. So that's something I would suggest everybody does. Probably, if you have cardiovascular disease in your family, probably in your 40s. not something that 20 and 30-year-old kids need to get done, but as you get older, it's more of a problem. Just know that if you're at 0, cool, get it done in 3 or 4 more years. If it's not, the higher the number, you need to start aggressively treating that because you need to dissolve that plaquing as much as possible, because that's the root. That's how endothelial cell are damaged by some of that plaquing being laid down by the cholesterol. So this is a summary that we made for you guys. So kind of your calcium scoring, 0 is great. So it goes from 1 is great. If you have 1 to 10, that puts your score to 7 of risk of having a heart attack. If your score is 11 to 100, it's an 8. 100 to 400 is a 9, and over 400 is a 10. This is the higher your number, the more you have an increased risk of having cardiovascular disease and stroke. It's a big deal. And it's a test that I don't see ran a lot. I do it a lot, but I'm trying to prevent this from happening. I want people to live here their whole life. And you can. You can be old and have a 0. But it's not common, but you can. So getting that score is something very important. If you're my patient, we can order that for you. If you're not, or you're watching this online, you can go to ProScan and ask them to have this test ran for you. It's about $120 here in Cincinnati. I don't know how much it is other places, but it's not super expensive and it's worth knowing what that score is. So these are some laboratory tests, kind of the least telling about cardiovascular disease, risk of stroke, and more important, this is when these numbers are high, and we don't use one number all by itself. Like this could be high and everything else is normal. Okay, we can deal with that. But it's when all of these are high, and it's when they're all high for a long time. That's when we get more concerned. So we're looking at the big picture here. It's not looking at 1 or 2 numbers to dictate your health, but we're looking at the whole picture. Trying to look at all of you. So when your lipid profile, you have a low risk of having vascular disease. When your particle sizes are when you have a lot of small particles or small dense particles, a little bit greater risk. The ApoE, this we talked about here, the ApoE, or the apoproteins, that's the genetic part of the condition. When your A1C is between a 5 and a 7, it puts you at about a 7, but when it's greater than 7, it puts you at a 9. It's a significant acute phase reaction which causes inflammation in your blood vessels and increases the risk of having vascular dementia. When your fibrinogen levels are high, those are the fibrous tissues that can break off and cause the vascular strokes. CRP, when that's high, your risk is at a 7. Ferritin, homocysteine, metallic protease at 9, hemoglobin A1C, and oxidized LDL. So these are kind of the hierarchy of this is not too bad, this is bad. And the longer this is high, the worse your risk are of death or having significant stroke, heart attacks, bad things happening to your vascular system. I kind of wanted to help you guys see the tests, rate the importance of the tests. So what can you do about it? So don't take all these supplements because you don't need them all. There are certain supplements that are designed to fix certain things. So resveratrol is probably one of the strongest and most powerful antioxidants for your cardiovascular system. That may be CoQ10. But resveratrol is something that's very important for your cardiovascular system because it helps to extinguish a lot of free radical damage. And the free radical damage causes oxidative stress, which impacts the inside lining of the blood vessel, which creates inflammation, which is what kind of causes cardiovascular disease and stroke to begin with. So optimizing your antioxidants is very important. Short chain fatty acids. We sell the product, so this is the nutrient, that's the supplement name that we carry. This is the nutrient, this is the supplement name that we carry. This is the supplement, this is the nutrient, this is the supplement we carry. So the tribuners, the short chain fatty acids, which help to reduce the TMAO levels. Helps to heal the endothelial cells inside the gut tube and inside your blood vessel tubes. Methyl B complex, B vitamins, methylfolate, methyl B12, that helps to that's the solution to having elevated homocysteine levels. So your body can so that methionine does not convert into homocysteine in methylation. Omega-3 fish oils. The therapeutic dose is 3 to 5 grams, so taking 1 omega-3 a day probably isn't doing you a whole lot of good. If you're 20, taking 1 omega-3 is probably fine, because that's awesome. But when you're 40s and 50s, you probably need to take 3 to 5 grams. Most supplements are about 1,000 milligrams or 1 gram, so probably taking anywhere from 3 to 5 of those a day is really important. And as you get older, you also need a lot more DHA. It's also another omega-3, which is more important for your brain, for your eyes, than for your cardiovascular system. So as you get more mature, we want to maximize both of those, and then eat as much omega-3 rich food as you possibly can. Taking potassium is important unless you have kidney disease. Do not take potassium if you have kidney disease. But potassium, which is kind of what the DASH diet is kind of driven by, really helps to reduce people's blood pressure. So if you take potassium, you want to slowly increase that, and you want to have a blood pressure cuff at home to make sure you're going in the right direction. So we've had great success on helping patients manage their blood pressure so that their doctor can get them off. I cannot. That's outside my scope of practice. So what my job is to do is to help the body heal, and then your blood pressure gets too low. Then your doctor takes you off medication. And why do you need 3 blood pressure medications? Why doesn't 1 work? Oh, it's still high. Let's give you more. No, the question is not more drugs, but why doesn't 1 work? Because you have vascular damage. Why do you have vascular damage? Because you're probably low in nitric oxide. Because you have too much critical damage, which is hammers at. Magnesium, most of us are deficient in magnesium. It's just not in our food anymore. So magnesium is a simple product you can take. One thing, some magnesiums, if people are sensitive to it, can cause diarrhea. So if you take magnesium and you have diarrhea within 2 hours, it's too much of a dose, just back off. Fiber is very much underlooked and underutilized in the cardiovascular system. Fiber really helps to improve the short-chain fatty acids in the body, which helps with diversity and the antioxidants. But look at the back of the fiber bottle. It shouldn't have a bunch of food additives and colorings and flavoring. It should say like psyllium husk, apple pectin, apple fiber. It should be very few ingredients that come from food. If you look at Metamucil and some of these other things, there's all kinds of weird chemicals in it and flavorings. I'm like, that's not fiber. So eat the potato skins, eat the apple skins. We need extra fiber for our cardiovascular system. Cheerios, a good source of fiber. Just don't use cow milk, use something else, use some of our plant-based milk. Vinpocetine and ginkgo biloba are great for increasing blood flow to the brain and to the rest of the body. They help to open up your blood vessels so you can get blood flow to your brain. Glutathione is sometimes considered the master antioxidant. That's also really important to help out with everything in your body. It really slows down the aging process, and it helps to put out the free radical damage caused by living in the world. Sometimes we use glandular products. Cardio Plus is a glandular product we use the heart, and it's literally bovine heart because it has every single nutrient that your body needs is inside that tissue. That's really helpful as well. And nattokinase is fermented soybeans. That's one of the biggest things to help dissolve excess fibrinogen and plaquing in your arteries. And the research shows that 400 milligrams away from food once a day that's the therapeutic dose. To help out with, if you have an elevated calcium score, that's the first thing we put you on is that, because that's going to help. Because it's actually an enzyme that's going to break down that plaquing and the soft fibrous tissues inside the blood vessels as well. So that's probably one of the most important things. If your calcium score is high, your fibrinogen levels are high. So what are you going to do next? Now that you know, you're held accountable to knowing now. So if you're not our patient, I would suggest that you schedule a consultation with us. We have patients all over the country. I always laugh and say we were using Zoom before it was cool to use Zoom, back before the pandemic happened, because Procter & Gamble and GE are right here in Cincinnati, and their employees, they shuffle them off all over the country. So I'm still treating patients I did 12 years ago who was in Seattle now and all over the place who were Procter & Gamble employees. So we had to figure out how we can still help them at a distance. So we do a lot of telemedicine for our practice. And for cardiovascular concerned, it's great because a lot of time the numbers really dictate the treatments. I don't have to physically touch you and see you. I want to do that. I want to interact with people, but I can look at your numbers and make recommendations from a lifestyle, nutrition, and nutraceutical standpoint from no matter where you are in the country. Or you can set up an appointment here with us here in the office. Take that list of blood markers and go to your PCP and cardiologist and say, hey doc, can you run these for me just to see where I'm at? Maybe they will, maybe they won't, I don't know. But that's what the research shows that is the most efficacious for cardiovascular disease. Know where those are. If those are fine, great, you don't run them a lot. But if they're high or borderline high, that means they're going to become high at some point in time. So really trying to get ahead of that is very important. And right now, I can't afford supplements. I can't afford to come see you, Dr. Boynton. I can't afford anything. We'll just start doing some of the lifestyle stuff. Start exercising, start walking. That doesn't cost you anything. Start drinking high quality water. Doesn't cost you anything. Stop smoking. That saves you money. Now you can use that money to buy some fresh fruits and vegetables. So having a healthy cardiovascular system doesn't have to be expensive. But doing those things at 80 aren't going to work. You gotta start doing those things at 20. So you don't end up having to spend the money and the expense and the health problems you do as you get older. And if you're not concerned about your cardiovascular system, who is? And you have to start early in your life. It's more important than you think. Modern medicine is too reactive. We need to be proactive. That's why the lifestyle part of cardiovascular medicine is so important. And if you in this room or online have been to a cardiologist, they might say eat better and exercise. And here's some medication. Like, well, what does eat better mean? What does exercise mean? That's what you should do. I don't know. That's just what they told me to say. I don't know. That's where we come in. We can help dial in that exercise priority. We can help dial in your nutrition. We can help dial in your circles. We can run the lab tests. We can fix the things so that you don't need medicine as you get older. And if you do, you do. Don't be foolish and not take medication because I'm not going to take medication. If you need it, you need it. But if you can prevent it from happening, that's always the goal. So that's our address. That's our phone number. You all know where our address is because you're here. That's our phone number, and that's our website. And I think I am done. And I am 3 minutes over. So close. Like the computer. So do you guys have any questions? Yes.
I started walking like 4 miles a day.
Awesome.
Is that too much? It takes me, don't laugh, but it takes me an hour and a half.
Why does it take you that long? Are you in pain when you walk that far?
Well, so I got really sore after a few days, my muscles.
Oh, sure.
And when I started out, I was very short-winded, but I've made a lot of.
That is so
I feel
good.
so much better
That's great.
now.
Mm-hmm.
I
No.
actually walked up steps today and didn't feel any pain. So
Nice. No, that's not too much.
okay.
Unless your heart rate is getting too high. So do you have a smart anything, or do you not check your heart rate?
Not yet.
Okay, so when you're getting wind, just kind of check your pulse. Just right here, I can show you how to do that. Just make sure your heart rate's not getting too high, because you don't want to have too high a heart rate for too long. That's why overexercising can be traumatic. But as long as your heart rate's not getting like staying in the 180s, as long as like 120, 140, you should be fine. Yeah. Good question. Anybody else got any questions?
If we ask our physician for those tests, would a regular physician be able to order it? Or
Absolutely.
all of them?
Yeah. Yeah, those are just common LabCorp tests. They might not know what they mean, just because they're sometimes not trained in those things. I don't want to speak for them, but they do run quite a few of those.
Okay.
But some of the other ones they're probably not familiar with because they're not common.
Yeah.
And sometimes they don't run them because there's really no drug that treats them, so there's nutraceuticals treat them. And sometimes medical doctors are versed in those things, sometimes they're not. So I think more younger doctors are more aware of some of these markers than the older ones. But if I'm having surgery, I want the older ones, not the younger ones too. So having a good balance in the medical system is a good idea. And if they can't, I can. And they're covered through health insurance, and kind of it is what it is. Yeah, these aren't like fancy, weird functional medicine tests. These are just LabCorp tests.
Okay, so you were saying that a lot of the high cholesterol is because of the damage to the vessels? Is,
The plaquing in the arteries is due to damage in the vessels caused by high cholesterol.
okay,
Your diet, unless you have a genetic condition, is why you have high cholesterol. And it's typically seen in processed carbs and inflammatory foods that increase your cholesterol.
so people that do have a genetic condition, what kind of, I mean, so it like omega-3, is that something that can help that?
It's something that can help that, yeah. So when you have a genetic condition like E4, like I have E4, I need to eat more of a plant-based diet. And because my body's not going to process cholesterol right in my liver, I have to take nutraceuticals to manage that, because if I don't, my numbers will be way worse than what they are.
So it has to do with your liver then?
Yes, cholesterol has to do with your liver, yes.
Because cholesterol is manufactured in the liver.
Correct. And that's where glycolysis takes place, which is blood sugar. It's how your blood sugar is processed and filtered to the liver too. And that's why people get non-alcoholic fatty liver, because the excess sugar that your body, the excess carbohydrates that turn to glucose that your body doesn't burn, turns into fat and gets stuck in your liver. So that's how non-alcoholic fatty liver occurs. Then your body has a problem processing fats and proteins, right? So then your cholesterol goes up. It's all kind of, the cardiovascular system is kind of like a vicious cycle.
Right.
That this rolls downhill to this, rolls downhill to this, and the further it goes downhill, downstream medicine, the more challenging it is to fix with nutraceuticals and even sometimes medications. And then surgery is really the only way to correct some of these conditions. So staying ahead of it is crucial. And it's not hard, it's just different than it's just different than how we were brought up.